today officiating Vice Chancellor of Sikkim Manipal University. I am very happy to announce the Bridging Borders for Better Health, and today's press conference is for that only. To my right side is Mr. Subendu. He is COO of Central Referral Hospital, and to my left side is Mr. Sanjay. He is the COO of the Medica North Bengal Clinic, and flanking them are Dr. Prithvi and Dr. Biplav and Dr. Mohanish and Dr. Manish Goswami. I am very pleased to announce today the Bridging Borders for Better Health. It's an initiative between Medica North Bengal Clinic, now taken over by Manipal Hospitals, which is the largest chain of hospitals currently in India, and Central Referral Hospital, Tadung, of the launch of monthly medical exchange program, bringing specialized care closer to Sikkim patients. 16 November 24, that is yesterday, Siliguri Medica North Bengal Clinic, a leading hospital in Siliguri, showcased its commitment to enhancing patient access to specialized healthcare in a collaborative effort to expand healthcare access and foster knowledge sharing among medical professionals. Medica North Bengal Clinic and Central Referral Hospital, Tadong, Sikkim, proudly announced the launch of the monthly medical exchange program. Through this program, esteemed doctors from Medica North Bengal Clinic will visit CRH for a full day of consultations, sharing their expertise and providing specialized care to patients of Sikkim, helping to close the care gap. The one-day clinic will feature doctors from various medical disciplines including gastroenterology, head and neck oncology, radiation oncology, cardiology, urology, neurology, and we are going to add many more super specialties in coming days. The doctors will be available for consultation, evaluation, and treatment recommendations. This initiative ensures that patients from Sikkim receive care that is timely, true, and tailored to their unique needs. The program will bring specialists across the two neighboring states from Medica North Bengal Clinic and Siliguri directly to Central Referral Hospital, aiming to bridge healthcare accessibility gaps by offering patients convenient, high-quality medical services. This collaboration is designed to enhance outcomes for individuals with complex or urgent healthcare needs, ensuring they receive the necessary expertise without the burden of long-distance travel or prolonged waiting lines. Additionally, it focuses on delivering high-quality care to patients of Sikkim who require specialized needs while nurturing a culture of learning and professional development among healthcare providers. Dr. Ainab Devgupta, Regional Chief Operating Officer, East Manipal Hospital, shared, the medical exchange program every month is meant to enhance the interaction between the two hospitals. By combining the strengths of both institutions, our initiative aims to deliver cutting-edge medical care while promoting continuous exchange of knowledge, research, and best practices. The monthly one-day clinic are only the starting point of a continuous cooperation between the two hospitals. AVM Dr. Dilip Chandra Agarwal, Vice Chancellor, Sikkim Manipal University, said, this initiative reflects our commitment to patient-centered care. By joining forces with Medica North Bengal Clinic, for this one-day clinic, we are able to enrich our community's healthcare experience and provide additional support for our patients. This program allows our doctors to gain exposure to new perspectives and provides patients of Sikkim with access to a wider range of expertise. Both institutions are committed to expanding the scope of this program with plans to introduce new specialists and additional services in the future. The long-term goal is to build a robust network of collaborative care that can adapt to the evolving needs of patients and healthcare providers alike. Thank you very much. Now,
Thank you. Thank you, sir. Thank you, our journalist friends, our Honorable Chief Operating Officer, Mr. Suvindu, sir, and also our doctors and consultants from both North Bengal Medica and Medica Cancer Hospital as well. And also there are other representatives from CRH. As mentioned by our Honorable Dean that we have inaugurated this doctor exchange initiative yesterday. Though before that also last week we have conducted a day-long consultation and procedures by the super specialist gastroenterologist from North Bengal Clinic. And it is just the beginning. I would like to mention that now Manipal has become the largest healthcare network in the entire country. And in the east, they operate around 8 hospitals plus this large medical facility in Sikkim. So it is this initiative to bring together all the good practices and the strengths of various hospitals starting from Kolkata, Siliguri, and Sikkim. So, started with gastroenterology, head and neck surgery, radiation, neurology. We will be adding many more super specialty services in course of time so that at large the citizen of Sikkim gets the benefit out of this huge network. We will be working in a very close knit way and exchanging other practices as well to extend the services to the last door of Sikkim. That is the commitment from Manipal hospitals. Thank you for participating and covering the whole event. I will like to extend my gratitude to all of you. Thank you.
now I call upon Dr. Manish Goswami for his remarks. He is the Director of Medical Services, Head of Surgical Oncology, Medica Cancer Hospital, which is also now the part of Manipal Hospitals.
Good morning, everyone. I think most of the things have been briefed to you already by respected Dean Sir and Mr. Sanjay. So I would like to be very crisp and precise on a few things. What brings us here and what services we are going to provide to you. Primarily what brings us here is the continuous effort of Manipal Hospital to provide quality healthcare to Eastern India. With Manipal taking over 8 hospitals in Eastern Zone, and now it has become the biggest network of hospitals in Eastern Zone, Manipal. It gives us the opportunity to provide super specialized doctors from different places. We are starting off with Siliguri. Kolkata is in line. It also provides doctors from Sikkim the opportunity to get trained, come for observership. We are also having a discussion with Mr. Suvendu to get our nursing staff trained so that we can come up with units in Sikkim Manipal where already we have done procedures. The gastroenterologist team which came down had already started doing procedures in your hospital so that quality healthcare starting from super specialized doctor, nursing care can be provided to you. That is one important. Secondly, Manipal Hospital is coming up by next year with infrastructural upgrade in both the hospitals in Siliguri. That is also going to impact the overall patient care in this region, North Bengal and Sikkim. Third thing, as I told, the ability of doctors getting trained somewhere in Eastern India with the chain of hospitals. Manipal runs 37 hospitals all over India. That is introduced into the overall system. So it is the first step to a sea of change that people are going to see, which eventually is going to come in over a period of time. Thank you. I would like to take questions if there are questions.
Before that, I would request our COO, Mr. Subhendu Prakash, to give his remarks.
I'm extremely thankful to all of you that you have taken time to come here. As we launch this program, we call it medical outreach program in the first stage, with the super specialities involved. Now, as we say, that Manipal is the largest hospital chain in terms of bed strength, which is 10,500 plus beds all across India, and surpassing even Apollo hospitals. So we need to take this opportunity, which is and the people of Sikkim need to take this opportunity, so that the amalgamation of this clinicians who will come here on a regular basis, and we should, instead people going from here to Siliguri, we can obviously we can stop them, we can ask them to see here. So that gives us a big advantage to all of us, to take these services from the expertise and clinicians coming from Medica Siliguri. And I would like to thank to each and everyone who has come here, who has covered this program. And I would like to say to all of you that if we can mobilize this or spread across to all the people of Sikkim, so that they can also reap the benefits we are going to get out of it. Thank you once again.
Now the forum is open for questions.
So is there anyone who can make it more understandable in local language, because half of the population won't be able to understand, at least regarding health issues, right?
Yeah, I would
so is there any
yeah,
person
yes.
I would request Manish.
Just summarize in few lines.
Yeah,
Yes.
I would request Manish. He's our professor and head of the Department of ENT, Central Referral Hospital, to explain in local language.
नमस्कार सबैजनालाई। आजको यो दिनमा चाहिँ हामी हिजोदेखि भनौँ है 16 तारिक नोभेम्बरदेखि चाहिँ मेडिका सिलिगुडी जुन चाहिँ अब मणिपाल हस्पिटलको अन्डरमा आएको छ र उहाँको टिम्स अफ डक्टर चाहिँ अब एभ्री मन्थ हामीले तय गरेको अनुसारले धेरैवटा स्पेशलिटी चाहिँ हामीले ग्याङटकमा सेन्ट्रल रेफरल हस्पिटलमा ल्याउने एउटा निर्णय र एउटा स्किम जस्तो ल्याएको छौँ। र यसमा चाहिँ के हुन्छ भने अब मणिपाल ग्रुप अफ हस्पिटल जुन चाहिँ अहिले इस्टर्न इन्डियामा वान अफ द लार्जेस्ट चेन्ज भएको छ है, हामीले अहिले सिलिगुडीबाट सुरु गरेको छौँ र सिलिगुडीको बादमा हामी कालकाटाबाट पनि कोसिस गर्नेछौँ कि हाम्रोमा अरू स्पेशलिटीहरू जुन चाहिँ जस्तै कि न्युरोलोजी भयो है, जुन चाहिँ सिक्किममै छैन अहिले स्पेशलिटी, त्यस्तो स्पेशलिटीहरू ल्याएर यहाँ हाम्रो लोकल मान्छेहरूलाई हाम्रो पेसेन्ट्सहरूलाई चाहिँ अब एउटा अपर्च्युनिटी जानु नपर्ने बाहिर है। म यहाँनिर 10 इयर्सभन्दा बेसी प्र्याक्टिसमा मैले के देखेको छु भने हाम्रो मान्छेहरू चाहिँ सिलिगुडी अब एउटा एकदमै मेडिकल हब भएको छ, हाम्रो सिक्किमको लागि भयो, दार्जिलिङ कालिम्पोङको लागि भयो है। अब यो सिलिगुडीमा चाहिँ किनभने एउटा त पेसेन्ट भोल्युम छ र इन्फ्रास्ट्रक्चर राम्रो छ, डेभलपमेन्ट अब वहाँनिर धेरै ठाउँको उसले गर्दाखेरि, सो त्यो चाहिँ अब हामी यहाँनिर गर्न सक्छौँ किनभने अब मणिपाल ग्रुपको नेटवर्कमा हाम्रो सबै हस्पिटल्सहरू सिलिगुडीको आएपछि डक्टर एक्सचेन्ज प्रोग्राममा यो त एउटा टिचिङ हस्पिटल भयो है, तर अब सिलिगुडीमा कर्पोरेट हस्पिटल्सहरू छन्, अब मणिपाल ग्रुपमा भयो, अनि त्यसले गर्दाखेरि स्पेशलिटिजहरू यहाँ आउनुभयो भने सबैजनालाई अब एउटा जानु पर्दैन। सो हिजो हाम्रो एउटा मनिषले अब हेड एन्ड नेक गर्नुभयो है, अस्तिको विकमा हाम्रो ग्यास्ट्रोएन्टरोलोजीमा अलमोस्ट 13-14 प्रोसिड्युर्स पनि भयो यहाँनिर। सो यसै गरेर अब आउने दिनहरूमा हाम्रोमा अरू स्पेशलिटीहरू न्युरोलोजी भयो, कार्डियोलोजी भयो, त्योहरू पनि सुरु गरिनेछ।
Yes, sir. So we started with gastroenterology in the first week of November 8th, and then we subsequently the head and neck surgeon and the radiation oncologist has come. So this is the start of the program, sir. And in the days to come, we will add up even more specialities to this,
including nephrology. We understand that nephrology is a very important specialty that is required for Sikkim, because we already have a very good dialysis center, and it is manned already by a specialist in the medicine department who is a sub-specialized in nephrology, but nothing like having a super specialist nephrologist. We are definitely planning to have them. Not only that, we are planning to have him in-house also shortly.
So what are the other specialties you are going to provide?
So to start with, the cardiology is a prime focus. Cardiology, urology, and these are the two areas which we want to focus, and then subsequently nephrology also we want to build up.
So can we call it as a medical Sikkim to be just medical hub?
Yes, sir. We can actually call it so for at least for the Sikkimis as well as the nearing towns in and out Sikkim, which includes the Kalimpong, Darjeeling of the West Bengal state also. as
That
we
is
have.
the eastern part of Nepal.
Yes, it includes an eastern part of Nepal. As we said, actually now Medica has been taken over by Manipal Hospitals, which is the largest healthcare chain in India right now. So, and especially in eastern India. So, if not Central Referral Hospital, as the Manipal Hospitals group, we are going to take over or take care of the entire population of not only Sikkim and nearby towns, mostly eastern India.
So is there any subsidized?
Obviously, we have to subsidize patients who cannot afford the super specialty case. That is already in our agenda, and we are expecting support from the government of Sikkim as well. The Chief Minister has been kind enough to support this particular initiative.
I would like to add to that. We are already empaneled with the government of Sikkim. The cancer hospital and the Pradhan hospital already provide treatment on subsidized rates. So I don't think that should be an issue. So I have been around for last 8 years. So we keep on operating cancer patients in Rangapani on subsidized rates. So that facility is already present, sir.
This particular amalgamation especially helps because Central Referral Hospital doesn't have a cancer care specialty. So joining hands with them, the cancer care hospital, that will be a very good help for the patients, cancer patients especially.
So just to add to that, the cancer hospital right now has got 80% of the consultants trained from Tata Memorial Hospital, Mumbai. And we radiate around 1,300 patients in a year. That is more than 100 patients every day in radiation. So we do somewhere around 7,000 chemotherapies in a year and 500 surgeries. So there are patients from Sikkim who come down to get the benefit of the services, and we gradually plan according to the complexity of the procedures to start some of the maybe chemotherapy procedures in Sikkim. So we were having a discussion with the. So the first phase would be training of sisters. Getting quality doctors is obvious, but we will first start with training of sisters and then proceed accordingly.
So apart from that, case of the specialty, so could you highlight us what are the manpowers that you are going to enhance?
Yeah, as he said, we are going to foster or we are going to strengthen the existing manpower with the specialized training because we have enough manpower to cater for it. What is required is updating of the skills and knowledge, which is going to be done, as he said, with this collaboration. And not only that, we are going to keep on building up the capacity through the other hospitals of Manipal, like for example Calcutta, he was saying, which is nearby. And also we include in future maybe people flying in from Delhi or even Bangalore. And locally also we would like to strengthen the manpower in terms of, because cancer care requires specialized care, both in terms of nursing care as well as the other supporting care. So we are going to build up that.
So apart from these one, so Manipal was started some resources on the cancer.
Yes, we have a very.
That concludes what are the findings on that part?
No, we are actually the 2-3 projects are ongoing cancer projects. One in the gynecology department on the early detection of cancer cervix. It's an ongoing project. We have not yet completed the project. Similarly, on HPV vaccination, that is a WHO funded project which is going on, and it has been found beneficial. And I'm very happy that Sikkim is one of the states which has taken up this vaccination to the young girls to prevent the cancer cervix. Many states in India have not yet taken up. But we here, because of the Central Referral Hospital and Sikkim Manipal Institute of Medical Sciences, the research provided the confidence for the government to take up that project. And I'm very happy to. We are soon going to have a breast cancer screening program, which is coming from Manipal Foundation in Bangalore, which is a very simple type of a cancer screening project. Earlier we had to. No, it is not with the state government. It is with Sikkim Manipal Institute of Medical Sciences. So, of course, we need the cooperation and collaboration with the state government because to reach to the remote areas in Sikkim, because this is a very simple procedure. Earlier, they had to go for mammography, which is available only in the tertiary care hospitals. It was difficult for the people to come all the way. But now it is a simple device. It's something like a handheld device, which you can go to the remotest place of Sikkim and do this. If this project findings are well done, then the Sikkim government can take up this, and this is a very simple gadget which can be provided in all the district hospitals and primary hospitals of Sikkim.